Welcome to the Sustainable Clinical Medicine podcast. I am your host, Sarah Smith. I am a practicing rural family physician and the charting coach. This is the podcast for physicians and advanced practice providers who are ready to step back from the busyness of their clinical day to share ideas, question everything, and redesign their clinical day. We are redesigning clinical medicine to create sustainable clinical days and create time for our lives outside of medicine. Join us for discussions with world experts who are helping design sustainable models of clinical medicine and the physicians or clinicians who have discovered or designed sustainable models of clinical medicine for themselves. Welcome back, everybody. Today we have with us Dr. Michael Foti, who is going to introduce himself in a moment. I'm excited to hear his story and his journey. So welcome, Michael.
Thank you. Thank you so much for having me, Sarah.
Perfect. So tell us about you. Who are you and your journey?
Yeah, definitely. My name is Michael Foti. I'm an internal medicine physician by training. I trained at Greenwich Hospital in Greenwich, Connecticut, which is one of the Yale New Haven hospitals. Um, and I'm now a clinical assistant professor of internal medicine at Toro College of Osteopathic Medicine in Middletown, New York. Apart from my teaching and medical background, I'm very much a big mental health advocate, which I'd love to get into, but basically, stems from my own personal experiences with mental illness. I've now become very much a strong advocate for helping to erase the stigma surrounding mental health, especially in the medical community. So that's my big passion at the moment and how I got here.
Love it. Love it. All right. So what took you into medicine in the first place? Why did you end up here?
Oof. I could say I always wanted to be a doctor. And, it's hard because I was so young when that first kind of popped in my mind and as a passion. But, I've been told a story that I cannot even remember because I was so young. But apparently, when I was a toddler and my older brother, who's a couple years older than me, um, came down with the chicken pox. We brought him to the hospital and not the hospital, I'm sorry, the doctor's office. And apparently we left the doctor's office, and my grandmother tells me that as soon as we left the doctor's office, I looked at her and I said, "That's it?" And she said, "Yeah." And I apparently responded, "Well, that's what I want to do. I want to be a doctor." So again, nothing but a toddler at the time. I don't remember this story. This is what's told to me. But suffice to say, my entire life, I've always wanted to be a doctor.
Yeah. Was that journey easy? Did you get in first time? Like, what was your experience with getting to there?
I did. I mean, it was a difficult journey in that, I needed to take a gap year after college and uh, take some more extra time to study for the MCAT, which I did. And the journey never goes to where you think it's going to be. After I scored what I scored on the MCAT, I was a little disappointed, and I then was told by my pre-health advisor of osteopathic medical schools, and because I had never heard of osteopathy or anything in that nature. And he told me, yeah, they much more look at the entire applicant. They don't focus too much on the MCAT as much as um, more the whole person in addition to the MCAT. Because I was I was almost a straight A student in college, and so I did very well, and I was involved in many extracurriculars, research, etc. So I researched osteopathy. I loved everything about it. The philosophy of mind, body, and spirit, and the osteopathic manipulative treatment that we're taught. And I love that they not only a holistic approach to applicant searches, which I really appreciated, but just in medicine in general. And I applied, and thankfully got into NYIT, or New York Institute of Technology College of Osteopathic Medicine. So not where I thought I was going to end up, because I'm originally from the Bronx, New York, so in the city of New York, and not too far. And where I was born actually is Albert Einstein School of Medicine, which is um, a big university hospital. And I always thought I would go to medical school there because it was so close to home. And that's not where I ended up, but I ended up exactly where I was supposed to, I say.
Perfect, perfect. Okay,
Yeah.
so you've come out of the Bronx, you've gone to medical school, you've taken a different path around, and then tell us the journey through medicine. What did you come across? What were the things, challenges and delights about training and becoming who you wanted to be?
Yeah, for sure. Medical school in and of itself was pretty challenging. I often tell many of these stories to my students to kind of help them relate and understand that everyone has difficulties in medical school. It's not, because in medical school, it's very easy to feel isolated. It's very easy to feel that everyone else is doing so well. Why is this happening to me? Why am I struggling? But everyone's going through a similar journey. And I had my own struggles because, like I mentioned earlier, I was almost a straight A student in college,
Mhm.
but in medical school, I very much wasn't. But I had to accept that my best was my best as long as I made the end goal, which was becoming a doctor. And so I did. So that I would say kind of like an overall challenge, I would say, for
Mhm.
medical school. And then in terms of residency, I was happy to match into my first top pick program, which I was so happy about. So that's a joy, I'll say,
Yeah.
as well. I loved my medical school as well, and I really much enjoyed that journey. I made friends that I still speak to this day, and same for my residency program. And so I matched my first choice. I really loved my training in that my attendings were wonderful, and they taught us so much. And I can't believe how much I learned in 3 years during my residency training. On the flip side, though, the second half of my intern year, so my first year residency training, was the spring of 2020, which, as everyone knows, was the COVID-19 pandemic.
Mm.
Some people like to say COVID residency. Well, that's kind of what I had. And it was, an atmosphere very much akin to a war zone.
Mhm.
It was, these were 12, 16-hour days. Your N95 was pretty much staying on the entire time. Emergencies left and right in the hospital, talking about, I was part of the emergency response team, and we were going in and out of patient rooms every hour, if not more so, which was extreme compared to pre-COVID, where maybe that was happening a couple times a day.
Mhm.
And not just with the frequency of patients getting sick and suffering really from this disease, but the age at which patients were coming in. I mean, as if everyone can remember, yes, this did very much affect the elderly pretty strongly, but a lot of our patients were young, 30s and 40s, and that made it really difficult too, because it's really hard to explain to a 30-something-year-old individual that they need to be placed on a mechanical ventilator because their lungs are so inflamed and they're not oxygenating properly. They probably never imagined this happening at that age, right? So it was devastating, to say the
Mhm.
least.
Mhm. Yeah, yeah.
Yeah.
And then you've kind of you've written a book. Tell us about the why. What happened that created this ability to tell us you're an advocate for mental health and your journey?
Yeah. So my book is called Grief, Doctor's Battle with Anxiety and Depression, and it very much details the intimate stories of the COVID pandemic and how much I really at first didn't grieve properly the loss of my patients, even though it
Mhm.
really did affect me. And also what happened around the same time of the pandemic, my mom was diagnosed with stage 4 lung cancer, and she passed away within 2 weeks of her diagnosis
Wow.
from complications of that at the age of 54. So it compounded how much of a difficult time that was. After residency, when became an attending, is when my journey with mental illness started, and I developed a pretty severe anxiety and depression. Um, and I suffered for months because I was almost partly in a denial that I thought it was just the stress of the job, and partly because I just couldn't believe this was happening to me, that
Yeah.
this wasn't supposed to happen to me, and like as if I couldn't do this career, that being a doctor. And so, and again, that all wraps up into the stigma of mental health, in terms of why. Now, eventually, I definitely, I was thankful enough to get the help that I needed, and
Mhm.
I'm doing much better now. But part of my recovery, as inspired by my psychologist, was to write down a lot of these moments to help get it out of here onto paper in a way to process all of this. And I did. And once all the speaking engagements started and continued and continued, I thought to myself, well, the speaking engagements could stop one day, but if I could have something really just concrete that could remain and touch more people than I could with speaking engagements and empower others to get the help that I eventually sought, then it's all worth it, right? This was very much an altruistic venture for me. This wasn't, this is nothing in terms of my primary income. It's just trying to reach as many people as I can. So it
Yeah.
became a book.
Yeah.
Yeah.
Oh, that's fantastic. And okay, so tell us about what was anxiety? What were you experiencing
Yeah.
that you said, I'm in denial. You can now look back and say I was in denial, but so what were you experiencing in the day-to-day that you eventually had a label for, but
Yeah,
you
for
didn't
sure.
initially know what it was? So what did that feel like? What was happening for you in your day?
Yeah. So every night I would experience the worst panic attacks I had ever experienced up until that point, whereby I was having a very intense pressure in my chest, as if someone was trying to rip open my rib cage, as if someone was trying to squeeze off my left arm, and it was tightening of my body, my abdomen cramping, and it was very intense and eventually would remit on its own. And then I would wake up in the morning and again, an intense fluttering in my chest. And this continued for months, every night and then every morning, every night and then every morning. And again, I started, the denial that I mentioned is I just started blaming it on the job. I thought, well, maybe this is just the stress of the job. My first job at a residency was actually being a residency preceptor. And I thought, well, maybe academic medicine was too much for me this early on in my career. Maybe this was just stress, right? So I then wound up pivoting and switching jobs to general primary care, just seeing patients, not teaching. Yet the symptoms continued and only worsened because then once it continued, I thought, well, this is never going to end. And then it turned into a depression.
Mhm.
And it wasn't until I finally got the help that I needed that I realized that I just hadn't processed all of the loss that I experienced, the loss of my patients, the loss of my mom, and had internalized all of that, and that came back to bite me, almost like a post traumatic stress disorder.
Mm, mhm.
Yeah,
It sounds like a terrible physical feeling on your body. Did you have that checked out? Did you attend to the physical symptoms?
yeah. So what eventually led to me getting the help was not just all on my own volition, so to speak. What I would say is I had probably the worst panic attack imaginable, where all the symptoms that I mentioned one night did not remit on their own. And then I thought, well, especially as a physician, I said, well, I really need to get this checked out. So I had my wife bring me to the emergency room. They did a full cardiac workup and other workup as well, and everything was normal. Um, I requested then to see a psychiatrist who spoke to me for quite a while, and that's when I was finally diagnosed with anxiety and depression.
Hmm.
Mhm.
Okay. Was there anything about your day when you were interacting with your residents and then your patients, staff, and others? Was anyone noticing anything different about you within your roles, you within your home?
At work, no, I guess I was pretty good at hiding it. At home, especially when the depression developed, yeah, I mean, my family was aware. Um, Once the depression really kicked in is when, I started hiding away in my basement, away from my family. I was ashamed to look at them because I had been dealing with all of this, and I thought I was going to lose my career. And I was, really, I felt such ashamed just to be me, and it was really devastating. So yeah, I mean, my family definitely noticed.
Yeah, yeah. You said you got the worst depression ever. So tell us about depression. What does depression look like for you day to day as you're going about your day? What are you experiencing in your body and other?
Yeah, I didn't want to do anything. I'm a very lighthearted person. I love being around people.
Hmm.
So for me, depression at its worst was not wanting to be around anyone. I didn't even want to be around my wife, my son, who I love so much, and um, I just wanted to be by myself, kind of wrapped up in a ball on the couch in the dark.
Mm.
Um, and it also, what depression meant for me was shame of just being me, embarrassment. Um, yeah, I mean that really sums it up for me. And it was probably one of the darkest times in my life.
Hmm. It sounds really difficult
Mhm.
to have experienced that, and to have you kept going to work during
Yeah,
this. Hmm.
yeah, yeah. I mean, when I was at work, I was very much locked in and focused.
Hmm.
Um, because patient care is so important. And it wasn't until I got home where everything then came out.
Yeah. Okay.
Mhm.
Tell us about your so in the day you said you're focused, you're kind of taking your eyes off the you and putting it onto your patients. Was there dread about going to work? Were you having any of that? No desire to be there. Like, what was going on there? Was there a sense of compulsion about having to provide for family? What else was happening in you for you?
Yeah, I mean, I didn't necessarily dread work.
Mhm.
Um, was I was very much stressed out because of what I was experiencing outside of work,
Mm.
and that which was very stressful. But it was more so, um, obviously that part of it was obviously wanting to provide for my family, but I'd always tried to find the joy in the day at work, and there were definitely moments. I loved teaching I loved teaching the residents, and I really was
Mhm.
sad when I left that position. They even got me a cake. They really enjoyed uh, having me and were sad to see me go. So my work did provide me solace in one respect because I did really love taking care of patients deep down. Um, but it really all came to a boil more so uh, when I was home, because then it was like everything would just come to hit me.
Yeah.
Yeah.
Did they ask you why you were leaving that position?
Uh, no, not really. No.
Okay.
I mean, I told them that what I told you, kind of what I thought was that possibly that type of position was just too much for me early in my
Mhm.
career, and that's why I transitioned to general primary care. And they accepted that reasoning, obviously. So yeah, no, that it wasn't too much after that.
Mhm. Tell me about the stigma. You said you were worried you were going to lose your job, you wouldn't be able to work in this profession again. Why? What is it that you were thinking about would be the consequence of this diagnosis?
Well, yeah, I think the stigma of mental health in general, but obviously, especially among the medical community, is that, mental illness is seen as a weakness, right? The culture of medicine that's been perpetuated for years is that physicians are supposed to just trudge forward and push through and not actually deal with these things. And of course, I felt afraid that I didn't know the support I could receive as a physician dealing with this, and how that would affect my career, right? And whether I'd be able to continue to work, which is unfortunate because what I speak about now is mental illness is just like any other illness. It
Mhm.
deserves to have the time and attention to be treated, and then you continue on with your profession, but it shouldn't be something looked down upon, stigmatized, and where physicians who are in such a high pressure role should be afraid to get the help that they need. They should rather, on the flip side, be empowered to get the help that they need, right? Because they're
Yeah.
doing such an immense public service as physicians that you can't, I say this all the time, you can't be a healer unless you first heal yourself, right? So um, that was why I was silent for so long. But I'm so happy I got the help that I needed so I could be in this position now to empower others to get the help that they need.
Yeah, I agree. I agree. We hear physicians, and I think it's changing, at least in the US, about having to report mental illness, that it's going to come
Mhm.
against them on their record, that it could truly feel like a career limiting diagnosis. was that something you felt was true for you in the moment when you were feeling unwell?
Yeah, I mean, it definitely crossed my mind, but, I did my research and found that, mental illness, anxiety, depression, it's a disability that's protected by the ADA. It's not
Hmm.
something that you need to voluntarily disclose.
Hmm.
And there's people like those at the Dr. Lorna Breen Heroes Foundation, of which I'm a part of, that are working on removing that as a question on the licensing requirement. So I hope we can get there.
I love that. It's so good. I think it's already been taken out from at least a few of the states, which
Mhm.
is super exciting to see. Okay, so we've got you as a resident. You've had a significant grief loss in your life on a personal level, and then you've got COVID, where you're seeing immense suffering and death and significant work hours in extremely difficult situation, right? This is a pandemic of significance. And then you're coming out the other side of it. We hear that during it, you push yourself. And then afterwards is when we're going to see that rebound mental effect. Like a soldier returning from battle is how I've heard it described in terms of the trauma of that, like you said, war zone that you were experiencing within the hospital system, plus the personal grief. Hadn't spent the time grieving, it's now having personal consequences. I think that, have you heard from others that this was an experience that they were having as well?
I will say that in terms of the experience that I had with COVID and then afterwards, I haven't connected with anyone yet on in that respect, but I'm confident that yes, there were many residents training during that time, and I'm sure there are many similar stories to the one that I have.
Mhm.
And that's why I do what I do because I'm trying to reach those people and everyone else. Now, I will say that many others have reached out to me in terms of just being whether they're in the healthcare field, medical student, or etc., who have reached out, appreciating that I share my story, that it resonated with them personally, and have even empowered them to make changes and get the help that they need, which has been very rewarding.
Mhm. Yeah. It is a huge step to have gone to the hospital with chest pain and said, I want to see a psychiatrist then. I don't want to underestimate how huge of a request that must have been in the moment.
Yeah. I was at a point, I remember just sitting on the hospital bed. I'm in the emergency room, it's loud and everything outside in the hallways, and I can remember to this day, like, laying there and saying, "Well, this isn't my heart. It's gotta be something else." And I just thought about my son and my wife. I said, "I gotta do something." I'm a physician, and I know the differential diagnosis, so to speak, of my symptoms, and I know what's there. And I just needed to face it. But I'll tell you, it was the best thing I could have done. The psychiatrist that spoke to me, it's funny, I tell people she doesn't even know the effect that she had on my life, and I wish she did. And maybe one day we'll cross paths and I can tell her, but um, she sat with me for hours and treated me really like a person, not a patient, and didn't even ask me the questions I expected her to. She just wanted to talk to me. And then all of this flooded out. So I'm sure obviously she knows what she's doing. And It was liberating in a sense because I was finally able to just accept what was going on, but also accept that I needed help, and even more so accept that that's okay, right? Because at the end of the day, I just wanted to be better for my family, and I would have done anything, and I did, right? So it was scary to take those steps. It was hard to, accept being put on an antidepressant medication, but I did it because again, I
Yeah.
just kept thinking of my son and my wife, and I was like, all right, I just got to do this. And it was hard to accept taking a medical leave from work and seeing a psychologist every week. It was difficult, but it was, like I said, the best thing I could have ever did because I'm in such a better place now.
Yeah. Yeah. Tell us about taking leave. How long did you have off?
I was about 3 months.
Okay. Yeah. Because
Yeah.
we hear
Yeah.
people saying I had a week off, I had 2 weeks off, I had 4 weeks off. You
Mhm.
had 3 months. Do you think that 3 months plus the tools you were given, so the medication, psychology every week, was it adequate?
Yeah, to allow me to get back to my life, for sure.
Mm-hmm.
Now, grief is a lifelong recovery,
Mm-hmm.
and I'm still grieving, but
Mm.
that allowed me to start grieving and then
Yes.
finally process all of this.
Mm-hmm.
So it got me on that journey, and I continue to process all these things. I continue to grieve, but I'm in such a better place now for it, where I'm happy and
Mm-hmm.
I'm back to me, Michael,
Mm-hmm.
and uh, yeah. So it was definitely more than enough, but I'm still working on me.
Yeah, yeah. I love this. I think it's important for people to hear that time off by itself might not have done what you needed it to do. You had these other resources and you had other people checking in on you. I think it's really important because of what you're describing here is I was not in a good place. I needed to find myself. I get back to who I am, and this is the tools I needed, which is really important. Yeah, yeah,
Yes, sometimes you just gotta take care of yourself. You know, especially as physicians, we take care of so many other people. But you gotta take care of yourself first, right?
hmm,
And it's like I tell everyone, it's not a weakness to seek that help, and if
yeah.
in turn, actually, it's the strongest thing you can do.
Tell us about seeing a psychologist. Was that in person? Was it online? Did you match the first time? Tell me about the psychology as a process, like seeing a psychologist. What was your kind of experience of that?
Yeah, so I saw a psychologist in person. I underwent what's called cognitive behavioral therapy.
Hmm.
And basically it allowed me to face my fears head on and process those emotions. And it allowed me to overcome a lot of that panic and anxiety by just being being okay with the symptoms, made them essentially go away. You know what I mean? What I learned a lot about anxiety is that it's a fear of the unknown, things that'll likely never happen.
Hmm.
And by putting myself in kind of imaginary scary situations in a sense, the psychologist is really good at doing, I was able to overcome that where prior to my mind would jump to all these things in the worst possible scenarios, it would catastrophize, so to speak,
Hmm.
right?
Hmm.
Um, and now I have such a self-awareness that I can see where my mind in certain situations would have went and say,
Yes.
wow, I'm in such a better place because I know where my mind would have brought me to, and I'm not there. So I love that I was able to overcome it in that respect. And then for the depression, really the biggest advice that I got was to spend time doing the things that I love and trying to find out what that was. And really that was spending time with my family.
Hmm. Okay,
Yeah.
so now I don't know how long it's been since you started psychology. What does looking after yourself now that you're back at work, what does that look like on a day-to-day, week-to-week? What would that spending time with family piece or other pieces look like now?
Yeah. So I'm a professor of medicine, which is phenomenal. And um I have the most grateful students imaginable that I'm teaching. And I really found the love. I've always loved teaching, and I've really found the love of teaching medicine and everything. The students, again, who are wonderful, my colleagues who are always teaching me something new every day, and the different things every day brings something new, which I love. I really found I'm very much a monotony with medicine itself, but I love that academic medicine really brings something new every day.
Mhm.
And I love going to work. I'm excited to go to work. I never dread going to work. I don't see it almost as work, and I love it.
Yeah, wonderful. What
Yeah.
does outside medicine look like?
So, in one respect, I'm involved in many things. So, through my passion for mental health advocacy, I'm part of an organization called NAMI, which is the National Alliance of Mental Illness. I am the vice president of the Orange County, New York affiliate chapter. So we basically work to not only advocate for mental health, but provide mental health resources to our community. I'm also on the board of directors for the New York State Osteopathic Medical Society. So where we tirelessly work to advocate for osteopathic medicine in New York State, um, which is just a wonderful also part of my life as well. And apart from those ventures, I basically, I speak where I'm able to share my story, including I have a podcast with a colleague of mine, Dr. Gina Marie Papia. We train together actually at Greenwich, Connecticut.
Yeah.
And it's called the Upward Spiral Podcast. And it's been wonderful just having great conversations with great people.
Yeah, love it. Okay, so there's still some clinical medicine, but it's more that you've branched into different areas that you're finding joy in.
Yeah,
Yeah,
yeah, more so academia, which has been phenomenal. I
yeah.
really enjoy the
Okay.
teaching.
Back to first love. Love it. Okay, really
Mhm.
good. All right. So if so you mentioned your book already. If people are wanting to reach out, hear more, where would they find you? What would be ways that they could
Yeah,
reach out?
yeah, I'm on LinkedIn.
Mhm.
So Michael Foti, DO. My podcast, which is on YouTube, the Upward Spiral Podcast. And I gotta have my book Grief, which is on Amazon and Barnes and Noble. So yeah, and any, that's where you'll find content from me or connecting with me would be on LinkedIn.
Perfect. All right. So if we have someone right now who is sitting in that, um, they could identify some of the things you're talking about when you were back in your anxiety or depression, and they're really scared, right? Because they're not showing it to anyone at work. No one knows. The family might see it and maybe saying some things, but they're really experiencing that manifestation of mental health. What would you say to them? Where would we start? What do you think are some first steps or things we may not have discussed this morning that you'd like to finish with?
Yeah, well, I would say for sure, apart from getting the help that you need, right? So I know sometimes it's very difficult. So I definitely try to seek some support in those around you, family, friends, wherever you have that safe space to get some support. Realize that people are more understanding than you think they will be and are much more supportive than you think they will be. At the end of the day, those that truly love you just want the best for you. And it's
Mm.
easier to get that help when you have people behind you. It was much easier for me to see a psychologist to start that medication when I had my wife behind me, pushing me and supporting me, and my son there and looking at him and knowing I'd do anything for him. So don't go it alone. Seek out those around you who truly love you to support you on that journey, and then take that first step.
Mm-hmm. Love it. Okay, so get
Yeah,
some help, have somebody there with you, find your safe spaces, and ask for the help you need. They're
100%.
going to be more understanding than you think they are, and they just want what's best for you. Love that. That is a really important message right there. It's really
Thank
important
you.
that we seek help and get what we need, the tools that we need to help us get better. Love this. Anything else
Mhm.
we didn't discuss that you would like to talk about?
No, I think that's it, but I do just really appreciate the opportunity to be on and speak with your audience, and, yeah, it's really just a pleasure. Thank you so much.
Yeah, my pleasure. It was really, really important to talk to you today. I really love this conversation. So, all right, you guys have a wonderful week. Go get some help. Make sure you identify your safe people and chat to them. Love it. All right. See you next time.
Thank you for being part of the Sustainable Clinical Medicine podcast. If you'd like to learn more or join us to help you get home with today's work done, go to chartingcoach.ca. There you'll find all the information on the premier Lifetime Access Charting Champions program that is helping physicians get home with today's work done, with all the proven tools, support, and community you need to create time for your life outside of medicine. We would love to see you there. Until next time, thanks for listening.